Honestly Aging by Friends Life Care VigR, a podcast where we explore what it's like getting older, the peaks, the valleys, and everything in between. In this season of Honestly Aging by Friends Life Care VigR, we are covering topics related to vibrant aging. I'm your host, Cheryl Praska. Let's grow old together. On today's episode, I'm joined by Darshan Bhatt and Kelsey Jachimowicz. Darshan, who is a physical therapist by training, is the president of Physical Therapy and Balance Center's Springhouse location. He's also the founder and president of Namaste Rehab, a company that provides therapy services to older adults at their place of residence. Kelsey is a licensed physical therapist and doctor of physical therapy. She's also certified in Vestibular and Balance Physical Therapy. Kelsey is the clinical director at Physical's Springhouse location, where she also practices physical therapy. Physical offers a medically based approach to health and wellness through comprehensive patient care using unique balance protocols and healthy lifestyle products and services. This is Darshan's third time on the podcast and Kelsey's first. I'm delighted to welcome both of them to the show today. Kelsey and Darshan, welcome, and thank you so much for inviting me into your clinic. How are you both today?
We're good. Thank you so much for asking, and thank you so much for coming and doing this wonderful podcast.
Oh, it's my pleasure. So we have Kelsey for about 15 minutes, and therefore we're going to dive right into the vestibular system. So Kelsey, can you please start by explaining what is the vestibular system and what does it do in the body?
Sure. So the vestibular system is your basically your inner ear. It's made up of your balance. So there's three systems involved for balance, which is your vestibular system, the sensory system, or the proprioception in your feet and joints, and your visual system. So those are the three systems involved for balance. And the vestibular system is the inner ear. So you have the outer ear, inner ear, and middle ear. And it's basically a sensory organ that is involved for your balance and helps you stand upright.
Now, what signs should someone look for that may indicate that they're experiencing a vestibular issue?
So if they're feeling dizzy, or if maybe they get a sensation of the room spinning, if they feel off balance or any ringing in the ears, can be indicative of vestibular issue. There's also other signs as lightheadedness, sometimes headaches or migraines, visual like bouncing. Sometimes patients will complain of that, or like motion sickness, or feel like they're rocking on a boat. They can be all indicative of vestibular issues.
Now, there's dizziness and there's vertigo, and these are terms that some people may use interchangeably. However, I understand there can be a difference between the two. Can you cover what that difference is?
Sure. So dizziness is more of the sensation of wobbliness, unsteadiness, imbalance. And then vertigo is actually true spinning. So either objects are spinning around the person or they feel like they're spinning.
So at the end of the episode, we're going to do a tour and you're going to see all the fabulous setup that Physical has. Can you tell us a little bit more now, though, how here at Physical you assess whether a person might be dealing with vestibular issues versus if it's that dizziness or just general balance problems?
Sure. So I start with taking a subjective history of the patient. A lot of times they will tell me exactly what's wrong with them just by talking to them. Then I'll go into the objective exam, and then I will look at with the infrared goggles, I'll look for eye movements in different positions. Head movements usually are triggers for dizziness and any eye movements. So I'll look at different head movements. And then a balance exam as well, just to see if they have a balance issue because of strength, or maybe they're fearful of falling, or they're weak in their hips and their core. And then also I'll sometimes ask patients to have blood work if I think it's non-vestibular, because there can be cardiac involvement, autonomic nervous system involvement, other neurological impairments that can be contributing to their dizziness or imbalance. So it's not always just black and white with vestibular population. So it's a lot of different systems that could be involved.
And let's say you go through your assessment and you diagnose that it is indeed an issue with the vestibular system. What could a typical, let's say, physical therapy session look like?
Yeah, so if it's a mechanical issue such as BPPV, benign positional proximal vertigo, then that's the inner ear with the crystals out of place. So I will do certain head movements and maneuvers to get the crystals back into place. That's more of a mechanical issue. The other issues could be an impaired VOR, and then we will do VOR exercises, habituation exercises, doing repetitive and a gradual buildup of exercises that trigger the patient, and then there's compensation as well. So if they need to either use an assistive device or maybe glasses to help with their impairments.
Outside of vestibular therapy, is there anything that people can be doing to help protect or maintain their vestibular health?
Yeah, they can definitely work on balance training and strength training. That is a big component of vestibular therapy. They can also do regular checkups with their doctors and regular eye exams as well.
Thank you. And thank you for letting me pepper you with questions. I just have one more for you. And I would love to hear what inspired you to specialize in vestibular rehabilitation as part of your physical therapy work.
So my first clinical, my clinical instructor was a certified vestibular therapist. So I saw a lot of vestibular patients with concussions, BPPV, other vestibular issues, and I thought it was really interesting. And then in school, we learned about it more, but I also wanted to take it to the next level, and then I completed a residency for vestibular certification. So I just found a passion in helping underserved population.
Well, congratulations on completing all of your education, and thank you for giving us your time today and helping our listeners learn. We are going to say goodbye to Kelsey for now because she has a patient coming in, and the next section of the podcast, it will be with Darshan and me. Would you prefer to age independently in your own home or live in a nursing facility? I know what I'd rather do. Friends Life Care membership offers just that. Plan today for a future lived at home with vitality, independence, growth, and resilience while protecting your savings. Learn about your options at a free seminar or webinar. Register at friendsLifeCare.org/register or call 215-628-8964. Welcome back to Honestly Aging by Friends Life Care VigR, where today I'm joined by Darshan Bhatt and Kelsey Jachimowicz to discuss the vestibular system, pelvic floor health, and physical therapy and balance centers. Darshan, so at FYZICAL here, the vestibular therapy is one part of the suite of balanced physical therapy that you provide here. Mm-hmm. Can you tell us more about the other types of balance equipment and physical therapy that you can provide here at FYZICAL?
Absolutely. That's a very good question, because like you mentioned, vestibular services and vestibular impairments are just one part of the whole balance paradigm. And a lot of people may suffer from multiple things that causes their balance to be impaired at the same time. So, for example, somebody might have dizziness that is as a result of their vestibular system being impaired, while at the same time also have musculoskeletal disorders or weakness, which could also be making them fall frequently. So to counter that, here at FYZICAL, what we do is we have our specialized vestibular training and treatment program, but at the same time, we don't want to take any chances, and we test and train everybody on musculoskeletal and other causes that could be causing somebody to lose their balance. For example, later on after the podcast, you'll see in the tour that we have the body weight supported harness system that includes a harness that is put around a person, and once it's connected to the system overhead, the person cannot fall. Now, if you imagine an elderly person who's having really bad weakness in their legs as a result of any given number of impairments, for them to undergo balance training would be a very challenging thing, because they're so fearful of falling in the first place that they would not be able to do any exercises, because every time they try to pick their foot up, they feel like they're going to fall. With this system in place, they can be assured that they are not going to fall no matter what they do. Each one of those harness and each one of those single points can take up to 600 pounds of body weight. So imagine we have a 25-foot system here. So you can have 25 people, each weighing up to 600 pounds at the same time, and still the system would work just fine. Not that we would have so many people at the same time, because here at FYZICAL, we really take pride in seeing everybody on a one-on-one basis, because that's what we feel is right for the patients, for the clients. Unlike some of the other therapy centers where you may see a lot of people being seen at the same time, and the therapist or the practitioner jumping from patient to patient, we just do one person at a time, regardless of what their impairment is, regardless of what their insurance is. We believe that everybody should deserve that one-on-one care that they're seeking, rather than having them come here and not giving them the attention that they need.
And I heard you say that people just generally might be experiencing dizziness or muscle weakness. Are there any other types of conditions or situations that you often see that the balance therapy can help people improve?
Absolutely, that's a great question. The biggest and easiest thing I would say is we see a lot of people that have neuropathy in their feet, in their hands, as a result of diabetes or other neurological issues. We see a lot of people with Parkinson's and other neurological conditions that has nothing to do with vestibular system, but it's mostly either neurological or musculoskeletal, which makes their balance worse. To give you an example, somebody who is going through active Parkinson's disease has their muscles and their coordination so badly impacted that they're having trouble stepping. Either their steps get really short and their balance is so far off that either they can't start their walking or they can't stop their walking. If you have them stand up to do an exercise, their balance is so bad that they can't even reach about a foot away from where they are. That's a neurological example. If you think about a musculoskeletal example, somebody who's been not able to move around a lot for any given reason, after a few weeks, our muscles start getting weaker, even though we don't realize it because we are able to do our daily routine just fine. So it may feel like we're at our base level. However, when we try to do something that is a little more challenging, that's when the body starts giving out. So for those sort of conditions, or the people that are experiencing those kind of conditions, it's imperative that we strengthen them first and then work on their balance, because until you treat the root cause, which is their weakness, you cannot work on their balance directly. Now, like you mentioned before, some people may have all of the above. They could be a neurological diagnosed patient and have muscle weakness and have dizziness or vertigo at the same time. But it's very rare to see everything at the same time, but it's very common to have two of those things happen at the same time, and which is why a lot of people have a hard time pinpointing what's the cause of their dizziness or of their falls, because they feel that, oh, well, my dizziness is because of vertigo, but otherwise I'm fine. In reality, they may not be, because their muscles might be so weak, because the dizziness that's being caused by the vertigo does not allow them to go out and do the exercises that they need in order to stay strong and healthy.
After hearing all this, I have to imagine there's going to be viewers and listeners who are saying, that sounds like me. And what would, how could they take this to their doctor to really advocate for themselves to get that, note or prescription or referral so they can go to PT?
Absolutely. And thankfully, we're in Pennsylvania, and Pennsylvania has enacted this law which is called direct access, which means that for a lot of the common conditions, a patient or a client can go see their physical therapist directly without having to go to their doctor first. We can see them up to 30 days without any prescription needed. But we, here at FYZICAL, we want to do it right. We want to incorporate a holistic approach. So the first thing we do is we reach out to the doctor and get that prescription or the authorization that we need from their medical providers so that they're in the loop. Not that we have to, but it's good for everybody to be on the same page so that we can take the best care of our clients. But to answer your question, either they can call or visit their primary care provider directly, or their neurologist or whoever they're seeing, and have them send us a script, or they can come directly to us and we can facilitate that so that it's less burden on them.
Thank you. I had never heard of that before, and I was making an assumption that you had to start at a doctor. So I'm happy to know that now.
Yeah, a lot of people don't know about this, which is I don't think it's the best thing for the people, because there could be a lot of people who have mobility issues or have other transportation issues that stop them from going to their doctor. And if those people are trying to get physical therapy services, then the first thing that comes to their mind is, oh, well, I can't go to PT because first I need to go see my doctor who's 30 miles away, and it's a hassle for me to go there. I have to call my daughter to have her bring me there, and all that is actually so much more easier now in Pennsylvania because of the direct access law.
Before we move into talking about pelvic floor health and therapy, is there anything more you want to say about the vestibular or balance therapy that you provide here at FYZICAL?
Yeah, like you listened before, the balance and vestibular services are so intertwined. However, they can be completely separate on its own, and it really boils down to having a balance screening done. And as a Friends Life Care member, we are offering free balance screen to everybody who is watching this or listening to this and would like to come in. And all they have to do is just show up. You don't need an appointment, or if you would like to make one, we are more than happy to. You can call us and we can schedule a free balance screen, no questions asked, no insurance needed, and let you see our place, let you go through the balance screen, and then you decide for yourself if you feel you need that balance services or that strengthening services before you commit to something.
Well, thank you for that. And also, just to the members, you can also reach out to your wellness or care coordinator if you want to have that conversation with them first. And thank you so much. I know, the wellness and care coordination team, as well as our members, will be thrilled.
Oh, I hope so.
So now let's talk about the pelvic floor segment of our interview. Can you talk about, define it? What is the pelvic floor and what role does it play in our overall health?
Absolutely. So the pelvic floor is a group of muscles that sit between all your viscera, so your stomach, your kidneys, your liver, everything, and right underneath that, there's a group of muscles that are so tiny that we often, don't even think about them, but they play a very key role in how our pelvic health, our gut health, our urinary and other systems work. That they're a very vital part of our body, and it's said that it's very often not taken care of for lack of education. So to say concisely, the pelvic floor is a group of muscles that are in your pelvis area that support all your organs, and they also help you control certain movements or certain functions. For example, when you have to go to the bathroom, but you can't find a bathroom around, the pelvic floor muscles are the ones that hold it in so you don't have an accident. Same thing with your bowels. Same thing in men. They also help with certain sexual function. Also, likewise in female, having a strong core and pelvic floor can help a lot of women, get rid of some of the basic things that they're facing, especially after childbirth.
Mm-hmm. So a lot of our listeners are way beyond their childbearing years. And I know that up until recently, I've associated pelvic floor health with, after having a baby.
Uh-huh.
Now, how does that change as we get older? Like, why might those muscles weaken? And why does it become even more important for older adults?
Yeah, absolutely. That's a great question. And to piggyback on what you said, a lot of people that hear about pelvic floor and pelvic floor dysfunction, the first thing that comes to their mind is, post-pregnancy
Mm-hmm.
or pre-pregnancy. And they're being told by their doctors that, you need to do exercises, or you need to do yoga or something so that you have a strong core, which would help you carry the pregnancy and then help you recover after the childbirth. If you fast forward 30, 40, 50 years from that, when you're no longer in childbearing age, think about all those muscles that have been neglected from that time when you were in your 20s, 30s, 40s, and now when you're in your 50s, 60s, 70s, 80s, or even beyond. Very few people actually take care of those muscles and work on strengthening them. Just like any other muscle, if you don't use it, you start losing it. If you don't strengthen it, they get weak. Like we were talking about just earlier, pelvic floor muscles play a big role in how we handle our urinary and our excretory functions. So if somebody is having problems with holding their urine in, or if they feel they're having urinary incontinence, pelvic floor plays a big role in how those things work. For example, you might have heard a lot of people saying, I need to rush to the bathroom at night because I'm taking a certain medication and it makes me use the bathroom frequently. Now, the medication is trying to get rid of water from your body for a reason. However, if you compare two people, one having a strong pelvic floor and core and the other one having a weak pelvic floor and core, undergoing the same treatment for the same condition, the one that has the strong core would have a very low likelihood of having incontinence because they have the strength in their core to hold that in rather than having symptoms or incidences of incontinence. A lot of people, even younger people, you may hear them saying, I have stress incontinence, which means usually you're fine, but when you suddenly go through a change physiologically, for example, you're you're walking and you suddenly sneeze or you cough really heavily, and that puts pressure on your kidneys, your bladder, your pelvic floor, and that leaks out some fluid. That's what we call stress incontinence. Is usually you're fine, but when the body is under stress, then the muscles are not able to hold that in. A lot of our elderly patients or somebody who has gone through certain kinds of surgeries or dysfunctions may have a weak control of their bladder and bowel, not because there's inherently anything wrong with them, but just because their pelvic floor has been ignored for so long that just strengthening that would give them some of that function back. Does that mean they're never going to have incontinence? Probably not. But if we can reduce that incidence to 10% of what it was, then that's a huge improvement in somebody's quality of life, in their safety. For example, if somebody is trying to go out with their friends and they want to have a day out, there's 3 ladies getting together, going out, but one of them is so worried that she's going to have to find a bathroom every hour because she can't hold it in or he can't hold it in, then that really affects their quality of life and the choices that they can make. But if they were working on their pelvic floor strengthening or their core strengthening, then gradually we can improve their strength to where they may not need to find or look for a bathroom so frequently. And that can give them the confidence, that can give them the safety that they need to go out and enjoy life like they should.
You went over a lot of pelvic floor issues that you see in your practice. Are there any that you think you missed that you want to touch upon?
Yes, I actually would like to talk a little bit more about male pelvic floor health, because male pelvic floor health is one of those topics that have been ignored for so long that people don't really even mention it anymore. Just like males have a pelvic floor, and we have urinary incontinence issues. It's a different thing that we don't like to talk about it, but it's one of those taboos that have been neglected for so long that a lot of male over the age of 50 or 55 have this issue, but are just not open to talking about it because there is no access to viable treatments. I'm here to say that we here are certified in male pelvic floor rehab, along with female pelvic floor rehab, and we are able to help those people who are having trouble with their pelvic floor issues, especially males and females, and help them get that quality of life back that they really would like to and deserve. Another thing that is not well known is a lot of the pelvic floor issues can also cause sexual impairments. And a lot of people, even as we age, are still active and they would like to be that way. And having a weak pelvic floor or core can really impair their abilities. So if it's not the incontinence, even for certain other issues that people may be facing, it would be imperative to at least get it tested and see if there is something that you can do before you go for a much more invasive procedure.
Absolutely. Now, I heard you say that childbirth can cause pelvic floor issues. Just the fact of getting older can cause pelvic floor issues. Is there anything else that you want to call attention to that can cause issues with our pelvic health?
Absolutely. A lot of times people underestimate the harmful effects of just sitting. So people that are sedentary and sit for more than a few hours a day on a stretch have much weaker pelvic floor and core than the ones who are more active. Just that act of sitting and not having that pressure go onto your pelvic floor and not being active can significantly impair the strength in your pelvic floor, and then that in turn starts that cycle of where you start having other issues and then you stop going out, you stop hanging out with your friends, you stop doing the things that really mean a lot to you as a result of these things that are going on in the background. So lack of exercise, lack of mobility, not having enough hydration, and other basic things that we can really teach patients and clients and members improve their health, pelvic and otherwise, would be a really good thing that we can do here at FYZICAL for people that would like to learn.
And just like in our balance section, I know there's members, viewers, listeners that are saying, that sounds like me. I think I want to see if pelvic floor therapy could be an answer to some of my issues. However, we also know that it is a very sensitive topic and one that most people don't talk about a lot. So I want to dispel some myths here, and I want to hear about what does an assessment look like, so people know we don't need to be scared of getting an assessment.
Yep, absolutely. And that's a very good point. Pelvic floor assessment can be very simple for depending on the type of symptoms somebody is facing. It can be a little more invasive for people who are really having a really hard time. But typically for most people, 9 out of 10, the exam is very simple. You know, we have this private room here where you don't have to worry about anybody feeling like their privacy is in jeopardy if they come into the clinic. Unlike other clinics that when you go in, you just see rows of tables there and everything is being done in front of everybody. Our motto here is the one-on-one care, and even after that, we still have this privacy rooms where if somebody feels that they would like to use that for their exam or for their treatment, we have access to that here. But going back to the exam part, it involves a lot of different things. First is always the subjective part. So we like to find out what the member or the client is going through, what kind of symptoms they're facing, when they're having that, what's the triggers, what makes it better or worse. Then we would like to do the objective exam, which means we do a hands-on exam. We try to palpate different parts to see if they're able to have certain strength in their muscles. Now, I want to clarify this. So we have a female who's certified in female pelvic floor therapy services, and we have myself who's certified in male pelvic floor therapy services, just so we don't have to have that taboo or that stigma about, well, I don't want to go to therapy because I might run into a woman and I don't want her, invading my privacy. And likewise for females going to a male therapist. Just to overcome that, we made sure that we have one each and they specialize in their own respective areas, so people don't have to feel stigmatized to come and receive those services. Now, jumping back over to the assessment, in the objective part, we start with manual palpation, where we would try and palpate and touch and press certain muscles to see if they're triggering. When we try to do certain movements. Each movement is associated with a muscle or a multiple group of muscles. When we do any movement in our body, that's only because some muscles are moving. Now, certain muscles work more than others to do certain movements, and certain muscles are stronger than others. So when we palpate or when we try to feel those muscle contractions, we can feel if the muscles are doing as good as they should, or if they're weak and they're not eliciting the response that they should when we ask somebody to do a certain movement. Another important thing is the range of movement. So, for example, if everybody's probably heard of a bridge exercise, when you lie down on your back, fold your knees, and you try to lift your pelvic area up in the air. That's a very simple exercise that we will be showing later on in the podcast. But that can give us a lot of information about how somebody's pelvic floor is reacting. Is it strong? Is it weak? Is it unilaterally weak, which means one side is weak but the other side is strong? Is it weak in the front? Is it weak in the back? Different muscles can do different kinds of things, and when they all come together and work as a group, that's when you have a perfect movement. So depending on how somebody's muscles are moving or the body is presenting, we can tell if certain parts of their body or certain muscle groups are weak, and that's how we know what to treat. So that objective exam, along with the subjective symptoms that the member or the client tells us, helps us create our plan of care to effectively treat that person.
And following the assessment, you're putting together a plan to help individuals improve on their pelvic floor health. What just might pelvic floor therapy look like? You started to talk about the bridge exercise. How else would you recommend people can strengthen their pelvic floor?
Yes, it's a very good question, because it's basically a lot of different types of exercises that we do here at FYZICAL, along with a lot of home exercise program. Because what we firmly believe that exercises are not meant to just be done twice a week when you come to the clinic, but you should continue that even when you go home, so that you are not only creating a strong core, but you're maintaining that for a long time. So it's a combination of a lot of different exercises that we have people do lying down on the mat table, or sitting up in a chair, or standing up, depending on what kind of muscles we're trying to strengthen. We also have access to a lot of different elastic bands and weights and other sorts of equipment to help people strengthen not only their core, but also their arms and legs. Because a lot of times, even with pelvic floor, it could be an issue around the hips, which is causing you to not have a strong pelvic floor. For example, somebody who has had arthritis in their hip cannot do certain exercises because every time they try to do it, it hurts so bad that they just stop. So we have to modify those exercises for that person so that they're able to do it safely and in as much pain-free range as possible.
Thank you for all of that, and thank you to Kelsey. We covered so much. I'm going to take my time to digest it. Just reminding our listeners, we talked about the vestibular system, we talked about balance in general, and we talked about pelvic floor health and how physical therapy at FYZICAL, or balance therapy rather, can help you improve your physical quality of life. Before we get onto the tour, is there anything more that you want to share with our listeners?
No, we would just like to thank everybody for listening to the podcast, and just remind everybody that we are just a phone call away, and feel free to just come in or call us and schedule your free balance screen as a Friends Life Care member. And while you're here, we can talk about whatever you would like to talk about as far as the issues that you may be facing, and we can get you seen here for that complimentary screening.
Thank you, Darshan. And now let's move on to the tour.
Hi, Friends Life Care members and friends. Today, my colleague Soha and I are on site at Physical Therapy and Balance Center in Springhouse, Pennsylvania. Darshan and Kelsey are going to treat us to a tour of the brand new center. And for anyone watching, come along and join us. Hi, Darshan.
Hey, Cheryl. How are you?
Good.
Good to see you too.
Thanks for having us in. And then we're going to get a lovely tour of the center with Darshan and Darshan's colleague, Kelsey. So if you want to tell us a little bit about FYZICAL and start us in on the tour, we'd love to see it.
Absolutely. First of all, thank you for coming in, and we love that you're here at mentoring, and we get a chance to show you our nice new clinic and what we can do with all the equipment that we have for all the members. Let's start with what is FYZICAL. So Physical Therapy and Balance Centers is a franchise for physical therapy clinics that provides specialized care, which is proudly one-on-one for each client, and we specialize in neuro, balance, vestibular services, along with pelvic floor services, in addition to all the orthopedic and general strengthening treatments that we can get at other clinics. Let's take a tour of our wonderful new clinic. Let me introduce you to our physical therapist, Kelsey, and she's going to show us about our vestibular treatment services right here in the clinic. So there you go, Kelsey.
Okay, so here's our private treatment room for vestibular services. We have our infrared goggles for vestibular patients that I can assess their eye movements and see it on the big screen. And then, yeah. So these are our vestibular goggles. They're infrared goggles. They have a camera inside, so I can see eye movements in the dark. Sometimes eye movements are hidden in room light, so the darkness will eliminate fixation, light, so then I can see eye movements. So here is how you put them on. Here on, adjustable. And then, so Darshan won't see anything in the goggles because it's dark inside, but there are cameras in there. As you can see his eyes on the screen. There you go. Yep, and then I will perform some vestibular examination tests, and I will look for eye movements in the darkness and see any nystagmus or the eyes beating, so to speak. So now I will demonstrate some vestibular tests. So this will be a head shake test. So I will shake Darshan's head 20 to 30 times. And then I will hold his head steady and assess for any eye movements in the goggles. And then I'll ask if he's dizzy.
No.
And then we can go into another test called the Dix-Hall Pike. This will assess for BPPV. So look to your right, your left, and then we'll come back down, and we'll be up. And then I'll assess for eye movements and see if there's any dizziness. Are you dizzy? Okay, good. Hold on to my arms, and then we can sit up. There we go. And then I'll assess for dizziness coming up again.
Let me show you the two private rooms that we have here for treatment. As you can imagine, some people that have treatments that they're going through could be very personal and private, and we want to give them the space that they need to feel comfortable when they're with their physical therapist. As you can see, this is our vestibular private room, and this is our general treatment private room right there, where patients and clients can get the services they need and deserve in their privacy. As you can see, this section on the left here is the balance area, and we have our body weight supported harness system, as you can see here, and the strings that are attached here can take up to 600 pounds of weight at each point. So if we have multiple strings attached here, each one of these can carry a person up to 600 pounds. As you can see, we have the staircase here for people that have trouble climbing up and down steps. And if they are having balance issues with that, we can use the harness, which we will see in a little bit, while they're going up and down steps. This nice little obstacle course has been set up here so that our patients who are having trouble doing different kinds of mobility activities can get training while they're here. We have a lot of different kinds of obstacles here. As you can see, there's a step, there's something that resembles stepping over obstacles. These little pads are softer pads that you can step on. This is a soft balance beam that when you try to stand on it, it takes your balance and it takes it for a little bit of a spin, so you can really challenge your balance in functional activities.
This is the harness for the overhead balance system. So we put it on by having the patient be seated, and then we put the feet in first, then we have them stand up. Put the arms in. A bit on the chest area. And the stomach area, so they're secured. Snug. So it should be snug so they feel secure.
So now we're going to connect Kelsey, who's wearing the harness, to our overhead system using this rope and the buckle here. This buckle goes on the harness like so, and then I can pull it tight so that she cannot fall. Now, with this system being on, each one of these points, as I mentioned earlier, can take up to 600 pounds of body weight. So there is nowhere that a person can fall once they're connected to this. Now we're going to have Kelsey walk through this obstacle course with the harness on and show how valuable it is in treating somebody who might have a balance issue and have them go through a very difficult obstacle course like this one without the fear of falling. As you can see, Kelsey's walking on this very soft balance beam that will be extremely challenging for a lot of people, even without balance issues. And here she's able to do it really well without the fear of falling. As you can see, Kelsey is now on this treadmill along with the body weight supported harness system where no matter what she does, she cannot fall. So if we have people who used to be in good shape or wanted to be an avid walkers or runners or joggers, but they are fearful of getting on the treadmill for the fear of falling, this body weight supported harness system would be the perfect solution to get them back on training and without any fear of falling. Let's see how it works with Kelsey. As you can see, the harness and the rope is holding Kelsey up. Even if she was to turn the speed up a little too much than what she can handle, the harness is not going to let her fall far too back or get sideways. This is a great way to train somebody who wants to get back into walking but cannot go outside their living space, but is fearful of using a treadmill for fear of falling. Now let's show you how this wonderful rowing equipment can help a lot of people who are having trouble with weakness but can't do the traditional techniques or strengthening with a lot of weight equipment. As you can see here, Kelsey is going to show us how rowing works. And while she's doing that, you can see that a lot of the pressure is first going onto her legs and then the arms, and then while she recoils, it's relaxing everything. This is a great way to strengthen your whole body as it works, not only your legs, but your arms, your core, your back, all at the same time with a very low impact movement that does not hurt your joints too much and that does not have any risks for falling or otherwise.
So over here we have upper extremity and lower extremity strengthening with tubing bands. So here we can do a simple upper body strengthening called the standing row, which gets your back muscles. And then you can pivot over here and do a lower extremity strengthening exercise for the glutes and the hips, such as standing hip adduction for the inner thighs, or going out for the outer glutes.
As part of our pelvic floor therapy program, we do a lot of exercises for men and women to help them strengthen their pelvic floor. One of the very important exercises for that program is what we call as the bridging exercise. It's a very simple exercise that can be very helpful to a lot of people. This is how you do it. You have your feet about a foot apart, with your knees about the same width apart, and I'm here holding a ball in between the knees just so I can keep it straight. And now I'm going to try and lift my pelvic area up off the mat, hold it for a few seconds, and slowly lower it down without holding my breath. This is one of the easiest exercises that somebody can do to improve their pelvic floor strength.
Thank you for listening to Honestly Aging by Friends Life Care VigR, a unique program focused on aging with vitality, independence, growth, and resilience. You can find links and show notes from this episode on our website at friendslifecare.org/podcast. Thank you to Darshan Bhatt and Kelsey Jachimowicz for joining us today. You can learn more about Darshan, Kelsey, physical therapy and balance centers, and Namaste Rehab by visiting physical.com/spring-house-PA, namasterehab.com, and LinkedIn. If you like our show, please rate, review, subscribe, and join us next time. To learn more about aging with vitality, independence, growth, and resilience, subscribe to our blog at friendslifecare.org/blog.